You are sitting in the parking lot of a spine clinic. The engine is off, the rain is hitting the windshield, and you cannot bring yourself to open the door. This terror of an upcoming appointment is paralyzing. This reaction is normal. For many, the anxiety surrounding surgical hardware, potential lost movement, or the unknown carries more weight than the physical pain itself. The Google spiral often fuels this state. It starts with a single search and ends 3 pages deep in a forum, reading out-of-context horror stories. Conflicting opinions multiply, and you find yourself convinced that waking up worse than before is an inevitability. These forums lack your specific context. Search results are general data points, and they cannot account for your unique spinal anatomy or the precision of modern surgical techniques. Fear is a biological protection mechanism. However, when those anxieties remain unspoken and unaddressed, that mechanism acts as a cage rather than a shield. While the mind remains locked in indecision, the body continues to deteriorate. Living with unaddressed spinal issues is an exhausting daily reality. It requires constant muscle guarding, avoiding stairs because you no longer trust your legs, and watching your physical world shrink as you cancel plans. Mechanical spinal conditions like stenosis, the narrowing of the space around your spinal cord, or slipped discs, get worse as you wait. Pressure on the central nerves increases over time, making future recovery more complex. Eventually, the exhaustion of standing in pain reaches a tipping point. The physical cost of staying still and bracing for the next spasm outweighs the perceived risk of moving forward. Choosing to wait out of fear is an active medical decision. It is a choice that guarantees the physical condition will continue to decline. You walk through the clinic doors and encounter a process focused entirely on empathetic listening. Surgeons like Dr. Kamal Woods bring specific unspoken anxieties into the conversation. He names fears of hardware and paralysis, giving you a safe space to address them directly. This schematic shows an unstable joint compared to a stabilized one. Spinal fusion provides essential protection, allowing fluid movement. Similarly, decompression surgery creates space for trapped nerves to breathe, restoring room for your nervous system. Information empowers your consultation. You review your specific MRI, walk through the step-by-step plan, and set concrete recovery expectations. Viewing surgery as giving the body the structural support it desperately needs shatters the initial paralysis. Emotional preparation is a measurable clinical requirement. Preoperative emotional states correlate directly with physical surgical outcomes. This chart compares recovery trajectories based on psychological state. The high anxiety line shows how unaddressed fear correlates with a volatile, prolonged recovery. Conversely, the informed and supported line shows patients physically heal much faster. Clinical data identifies emotional readiness as a critical component of the healing process. It is a vital indicator of how a patient handles the post-operative window. Treating this psychological fear is the necessary first step before any surgeon can successfully treat the physical spine. Outdated expectations of massive incisions and weeks in a hospital bed do not match the modern clinical reality. Modern minimally invasive techniques utilize an incision of only 1 to 2 inches. Specialized instruments gently part the muscle fibers, preserving the tissue so it can return to its natural shape and heal quickly. Robotic-assisted systems allow surgeons to place supportive hardware with absolute millimeter accuracy. This precision removes the guesswork from the procedure. Many of these procedures occur in dedicated outpatient centers. Patients bypass the general hospital environment entirely, recovering in a specialized, quiet setting designed for spine care. Internet horror stories based on legacy procedures do not reflect the safety and speed of modern spine surgery. Most patients stand up and begin walking within hours of the procedure, leaving the surgical center to recover at home that same day. Physical independence returns in small, significant ways. You walk through a grocery store without needing to scan the aisles for a place to sit down. Priceless victories follow, standing in a kitchen free of nerve pain, or safely playing with grandchildren on the floor. Action taken in the presence of fear is the definition of courage. A completely pain-free, independent life is achievable. The journey begins with an honest conversation.